You're watching CreekBox TV.
Welcome back to CreekBox TV, everyone. I'm Alan Handley. Coming up, you're going to hear from Miss Angela Ammons. She is the hospital administrator for the Clinch Memorial Hospital, and Miss Lily James. She is the public relations director. Y'all hang around. This is going to be a good episode. We're going to talk about Clinch Memorial Hospital, COVID, and a lot of things that's going on here in Clinch County. So just sit back and watch CreekBox TV. We'll be right back.
You're watching CreekBox TV.
Welcome back, everyone, to CreekBox TV. I'm Alan Handley, and today I have two lovely young ladies from the Clinch Memorial Hospital. We have Miss Angela Ammons,
yes,
who is the administrator at Clinch Memorial Hospital.
That's correct.
And we have Miss Lily James, who is the public relations director at Clinch Memorial Hospital. Appreciate y'all taking the time to come talk to us at CreekBox, especially this time with all the virus and everything going around. Miss Angela, tell us a little bit about yourself and what you do at the hospital.
Well, just like you said, I'm the hospital administrator. I am wearing scrubs just because that is my background today, and I'm dressed to handle whatever comes our way. But my background is a registered nurse. I was trained as a critical care nurse, went to college at Coastal Georgia for my nursing degree, and I have been here 4 years as of September 25th. That's amazing.
I'm
Can't believe
telling
it's 4 years.
Very good. We're glad to have you, too, here in Homerville.
Thank you.
Lily, tell us a little bit about yourself, darling. I've known Lily since T-ball at the rec park. So.
Yes, so I grew up here in Clinch County, and 4 years ago, I went to UGA, and I studied public relations and minored in health policy and management. And on June 1st, Miss Angela, I joined Miss Angela's team here at Clinch Memorial Hospital. And I'm so grateful for that. And I am now the Director of Public Relations and Foundation at Clinch Memorial.
Man,
we're so fortunate to have her.
Oh, I guarantee you. I mean, and we're so lucky as a small town to see them go away to college and then come back home.
Yes.
And have a job here and contribute back to the community. Miss Angela, the hospital, you know, the regional hospital, I didn't realize this till today, opened in 1957. And in which I was born here at the old hospital in 67. I'm telling my age, so I mean, but that's a long time ago. So Dr. Chisholm actually delivered me, and you know, that hospital ran all the way to 2007, I think, when the new one was built.
That's correct. Yes.
What kind of, I mean, from the old one to the now, man, I know it's one of the best places to eat in Homerville.
It is, absolutely is. Yes.
That's my expertise, is eating.
Yes.
But tell us some of the programs you have at the new hospital, darling.
Well, we are a 25-bed critical access hospital, and we have a 24-hour ER, lab services, radiology, and it has a lot of the latest technology. We have physical therapy, and we just opened a couple of weeks ago, right, Lily?
Yes, ma'am.
A brand new retail pharmacy.
That's great.
That's very important to us because we want to make sure that we have a good access and choices for all of Clinch County.
That's right.
We also have a brand new family practice that's a little bit over 18 months old, and we are hoping to very soon open a satellite family practice clinic over in Fargo, Georgia.
Oh man, that is great.
Yeah.
You know, Fargo, and now with the pharmacy, I know, like if you went up there after 8 o'clock, you had to wait the next day to get your medicine. Now with the pharmacy, I guess if you go to the hospital, they can fill it right there.
Well, it just depends. So we will always adjust our schedule based on the need, but just starting out, one of the important things is if you've ever been in the hospital, one of the last things you want to think about is getting discharged and then going and waiting an hour at a pharmacy.
That's right. Oh.
So we have a meds to the bed program. So if you choose, or anyone that chooses in the hospital gets your prescriptions filled, they'll be ready for you by the time you discharge.
Man, that is great.
And if you go to the ER and we're open, you can step right over and we can fill your prescriptions, but we will look at expanding those hours when the volume picks up. But we have pull up and park. We'll bring your drugs right out to you, your meds right out to you.
Man, that
and
is
hoping
great.
for delivery service very, very soon.
Man, that is great. Well, we're moving up here in Homerville.
I know,
we
very
are.
excited.
Lily, since you've been hired, what's some of your daily chores that you have to do at the hospital, darling?
So as part of the public relations side of my job, I do a lot of the promotionals for our family practice, the pharmacy now, and all of the services, but I also have been planning this week a community outreach task force. And so I know we're going to get to the vaccines and COVID in a minute, but next week we'll be going out into the community to provide vaccines to the Fargo community and Peerage. So we're hoping to improve access to those communities that are a little underserved. But on the other side of things, which is the foundation and fundraising, I am the go-to person for the Georgia Heart Tax Credit, which is a 100% tax credit where you can reallocate your tax dollars to a rural hospital of your choice, hopefully Clinch Memorial.
That's right.
Yes, and that's been a really great program, and it's really been just a fantastic way to support our hospital at zero cost to you, because the taxpayer is already paying these taxes anyway. They're just designating it to a different place. So it's money you're already paying anyway.
That's right.
And that's just really been very important to our hospital, and we're very grateful for that program.
Man, that is great. Angela, with everything that, the virus coming back, of course, and we are going to touch that after our first break, man, it looks so busy at the hospital. I mean, is there something you can when do people, to get tested, a lot of people don't know, do you go to Dr. Sam's or somewhere? Do y'all do that at the hospital?
We do, and the first thing I say is trust your provider. So if you have a long-term provider, always reach out to them and get the advice of the provider. But I just want the community to know that we are here to serve you and to offer access to those type of things. And if you come to our ER or you want to come and get tested, we do require a doctor's order.
I got you.
So you can go to our Clinch Memorial Family Practice if you do not have a physician, or your local provider in town, and ask for that. But I do have to say, because of COVID and the numbers increasing, we have limited availability. So they started rationing COVID tests that they're sending us. So that's why we are asking for people to get a doctor's order, and you must present with symptoms.
That's right. That was my next question. If just because you hung around someone and you don't have symptoms, unless you have symptoms, you really don't need to go to your doctor or to I guess whatever makes you comfortable. But I mean,
right now it's a huge waste of resources. We really have to be careful, and we have to utilize those resources for people who are very sick.
Because I've got a couple of friends been tested 4 or 5 times. They've been negative each time. So if you look at it, man, that's 5 tests, that we could have used elsewhere. I know they're concerned. I know I went to the hospital. That's where I got my vaccination at Clinch Memorial Hospital back in March, I think. It was way back. So that's going to lead us into our first break. We're going to hear a word from our sponsors and come back and talk some Clinch Memorial Hospital. We'll be right back.
This has been my first experience with Walker Jones Nissan. Really, the thing that sold me was the fact that I had a good value, had a good product, but overall was the kindness and the love that was shown from the actual employees. From the top to the bottom, they're always there. So I prayed with them and I prayed for them. You can get a good deal from a lot of places, but you don't always get the follow-up like you get with Walker Jones's personnel, and that I admire.
So, what's it like living in a small town? Well, to me, living in a small town is great. I mean, from late night drives down back roads to knowing everyone's name at church and knowing all my customers' names too. Speaking of which, I'm actually going to be late. I mean, technically it only takes like 2 minutes to get to work, and I still have 5 minutes, but I like being early. Catch you later.
Carrot Collection Event Center in Pearson, Georgia is a premier event center for South Georgia and North Florida. Carrot Collection Event Center has everything you need for that special event, including 25,000 square feet of space, a full catering kitchen, spacious restrooms, and stage. Also, drop by and take a look at Carrot Collection's large inventory of gold and fine jewelry. Call Chuck at 386-397-3708. Carrot Collection in Pearson, Georgia. Homerville Jewelers in Homerville is your headquarters for bridal and baby registry. Our newly remodeled location has that special gift for the bride and groom, or that perfect gift for the new baby. Homerville Jewelers has the gifts that are suited for any special occasion, whatever it might be. Homerville Jewelers can perform jewelry repairs and offers a variety of diamonds, gold, sterling silver, watches, and necklaces. No need to shop out of town. Homerville Jewelers can supply all your gift and jewelry needs. Let Kathy Townsend and staff serve you at Homerville Jewelers, East Dame Avenue, Homerville.
You're watching CreekBox TV.
Welcome back, everyone, to CreekBox TV. I'm Alan Handley, and I have Miss Angela Ammons and Lily James from the Clinch Memorial Hospital. We're sitting here talking about the advantages of having a hospital here in Clinch County. And during the break, Miss Angela, I was telling you, when I was at the rec park, they were talking about closing the hospital at one time, and it's the heartbeat of the community.
It is.
Without a hospital, you can ride through rural Georgia anywhere, and when you ride through and you see buildings that are closed, it's because a lot of times it's a hospital.
Right.
I mean, it's your hospital and school system. That's 1 and 2. You can put either one you want, but I mean, that's the first two things people look at when they move into a community is education and the hospital.
First thing they ask for, any new industry, they want to know about the school system, they want to know about the hospital.
That is exactly right. And what are some of the important things at the hospital?
Well, one thing I want to stress to everyone is that we have worked so hard over the last 4 years to try to reverse a lot of the negative stigma around it. And look, I'm not perfect. I fail every single day, but I have a mission, and it's to save the hospital and to expand healthcare as far as I can within Clinch County. We have done a lot of work, and my team, it's not because of me. I have an excellent team like Lily that makes me look amazing. But when I first got there, I mean, we had 3 days cash on hand. And as a business, that's horrible. And the auditors who present our financial statements, my second board meeting was them telling us that we are looking at closure.
I know it. That was
if we
scary.
don't do something different. And I make it a personal mission of mine to make sure that doesn't happen. But we are just not a Band-Aid station. Our doctors pass the same state boards. Our nurses pass the same state boards as large tertiary facilities. And critical access hospitals like Clinch Memorial was established so that we can save lives.
That's right.
So you don't have to drive 45 minutes
That's right.
for an emergency. And we have a helipad. We have immediate access to larger facilities. We have 1-800 numbers that we can call, and we can get you out as soon as possible. And you, as a rec leader, right?
That's right.
Probably
Retired rec.
coaching, consistent. Really, big changes happen when things are consistent, right?
That's right.
A great player isn't created when he goes out there and does one good thing every 3 weeks. So the community's responsibility is to consistently support the hospital. Get your labs done at our facility. Get your prescriptions filled at our pharmacy. If you don't have a physician, and I know we have some great physicians in town, you have long-term established relationships. We have a family practice that can see you. It's the little things whenever you need us that really helps us survive. And we went from a hospital that was facing imminent closure to being featured in Time Magazine in November 2020. Our team has won Hospital of the Year, CEO of the Year. Fox News visited last week and interviewed our facility. And it's because they realized that we are an independent hospital that does not have a big brother that filters in any money, and we are doing everything that we can. So when you have an option to get physical therapy, get it done in our facility.
That's right. X-rays,
when you have a
everything, do it
CT
all.
scan, mammography, any of that, all the little things help. All of it helps. And we have some great programs, and we have big dreams. And we really want to continue to do great things here in Clinch County. And we went from employing 90 employees to 150 plus.
That's right. That's
and the
very good.
economic driver for a county is huge. I mean, we pour millions, and I mean millions, because you think about all the salaries of our employees. Where do they spend their money?
That's right.
So we want to make sure that continues to happen.
That's right, and that trickles right down to the rec park, splash tax, everything.
Yes.
I mean, it helps the youth and all. And Lily, you coming from Athens back home, which you grew up here, darling, and we were talking, you can't order takeout here now. Not like we might have one pizza place.
No Grubhub.
You're back to Roman noodles here.
Yes.
What's some of the big changes you've seen since you went off and come back?
In Homerville or
Yes,
the
ma'am.
hospital?
Homerville.
I've just really seen lately here a big drive to improve the community and the way it looks, the landscaping, the businesses here. I think that people are really coming together, and I hope this drive continues. But what I want to say about the hospital's role in that is without this hospital, businesses will go away. This town will die, and I hate to say that, but our hospital and our big initiatives and big dreams, like Miss Angela said, really it aligns with the goals of what I think is going on with the community to improve Homerville and to make it grow. And that's what our goal here is at the hospital, is to grow ourselves, and with that, grow the community.
Yeah.
That's right. And we had Lily's mama on here the other day, Lori, and we're in the process of building a new school.
Yes.
You know, I mean, it just
Growth
you
is
know, I
a
mean,
great thing.
And it all starts with the new hospital, right down to a new school. And talking around the community, you know, we have a lot of patients right now in the hospital due to COVID, but they're not just from Homerville. We're getting patients from out of town. Is that right, Ms. Angela?
We do. Over 18 months ago, we developed a new service line at the hospital because I realized that we needed to save the hospital. We were not getting the admissions from our own residents in order for us to sustain a 24-hour ER. So we partnered with Miller County, and Robin Rao, who is a powerhouse of a CEO, agreed to be my mentor. So we started getting patients from all over, South Carolina, Florida, and so forth, long-term ventilator and trach patients to our swing bed program, which we did not know when we started the program that was really preparing us to get ready for this pandemic. So we do have patients from several states over that come to our hospital, that choose to come to our hospital. We started the med stabilization program, which is we help patients go through withdrawals of opioids and alcohol. We had someone fly in from New York City to attend our program.
Man, that is great.
That is, and so, you know, I know that change is not easy for everyone. It's not easy for me. It makes me uncomfortable, but it also helps me to grow.
That's right.
And then months later, we can see the benefits from that. But we have these service lines established so that we could prepare for COVID, so that we could take the onslaught of that. And people think, oh my gosh, healthcare is free. You know, the hospital is making all this money, but in reality, it costs a lot.
That's right.
It really does cost a lot. And what I want the community to understand is just to be mindful of the resources that we have to expend. Just like you said, he had a friend that got tested 4 or 5 times because he had been exposed to somebody. Well, when manufacturers start limiting our supply,
That's right.
then people don't understand that. And so we have to have that supply for when people get very sick. And right now we're capped at a certain amount just because I don't have the staff. It's very hard to see some empty beds in our hospital, but when my nursing staff's kids are getting sick with COVID, or when they're getting sick,
That's right.
and some are sick, or taking care of people who chose not to get the vaccine, they can't come to work. And that really limits our ability.
That's right. That's right.
And so my nursing administration team, they have an office job, but they're in scrubs every single day because they jump right in and they help whenever it's needed.
Man, that is the number one thing over the last, I don't know how y'all have done it for the last year and a half, going on 2 years with this deadly disease. I mean, do we see the end coming anywhere? Are we getting better, Miss Angela? Or?
I think the only way that we can really see the end, and I understand there's a lot of people who have arguments about the vaccine, but very few people who have the vaccine need hospitalization.
That's right. I mean, the math doesn't lie. You
Yes.
can look it up, do your own homework, but I mean, it doesn't. I mean,
Yeah. And never in my nursing career, and when I went to nursing school, we had to do a triage class where we chose who lived and died on this fake island. I thought, I'm never going to use this. Last year during the pandemic, I literally chose who got a bed at another facility.
man,
When
that would be
you have
awful.
3 or 4 people and St. Joe's or St. Vincent says we can take 1 a day, and we would call 70 hospitals a day to get the sickest of patients out. 70, we were told no every single day. And so I had to choose, our nursing team had to choose who got to that bed. That's very hard on us.
Oh, good
It's extremely
Lord,
hard on us.
I
So
would
we're asking everyone to do your part. Wear your mask. And guys, we are vaccinated, but wear your mask when you're going out in public. Please consider getting the vaccine. Socially distance all that you can.
Well, man, that's going to lead us into another break, and we're going to hear a word from our sponsors, and we'll be back to talk some more Clinch Memorial Hospital.
At Douglas Metal and Steel Manufacturing, we only use top quality steel and roofing. And with our on-staff custom designer, we can customize your building to best suit your needs. From large commercial, agriculture, or just a place to store your stuff. And it comes with a written 40-year warranty that we'll put in your hand. It's not just quality we stand behind, but we stand on. Call today for a free quote. Douglas Metal and Steel Manufacturing. We are steel number 1.
Camping World of Valdosta, located in Lake Park, is your one-stop destination for all your camping needs. Stop by to see your dreams of quality time with your family become a reality. Whether it's tailgating with your air-conditioned camper, taking a trip to the mountains or beach with your family, or driving your motorhome to a faraway destination, Camping World has it all. Let us put you and your family in a camper for as little as $99 per month. And remember, when you buy a camper from Camping World of Valdosta, you receive a free Elite Good Sam membership, roadside assistance, and travel assist for 1 year. For the best pizza and wings in town any day of the week, check out Huey's One Stop in Homerville. Drop by, fuel up, and let Mr. Nick Patel and staff serve you some mouth-watering pizza and wings that you won't soon forget. Or just take that favorite pizza and box of wings home. Call 912-487-2338 to order your pizza and wings every Friday night after the game. Huey's One Stop, 193 Church Street, Homerville. Lee Engineering and Construction Company in DuPont, Georgia has been a part of the community since 1935 and is proud to support Clinch County athletics. The prayer of the entire Lee Engineering family is that our Lord and Savior will richly bless our schools, community, and nation. Mike's Golf Carts and Power Sports in Douglas has the cheapest prices in South Georgia and a huge inventory of new and used gas and electric golf carts and off-road vehicles. Mike's also has parts and accessories and proudly serves customers across the states of Georgia, Florida, and Alabama. Whether you stop into our store or shop with us online, we have everything you need for Can-Am, E-Z-Go, Club Car, and Yamaha. 0% financing available for qualified customers. Mike's Golf Carts and Power Sports in Douglas, Georgia. At Burt CPAs, helping small businesses with their accounting needs is our business. We have offices in Homerville, Waycross, Alma, and Baxley. Burt's professionals are ready to serve you no matter your location. We are your team for accounting, bookkeeping, tax, and financial advice. In Homerville, call firm partner Adam Toll. Dairy Queen is a proud part of our local communities and is cheering our sports teams on to championship seasons. Drop by before and after the game to say hello to Mr. Ash and his entire crew and enjoy the full Dairy Queen menu, including our famous grilled burgers, artisan-style sandwiches, and chicken strips. Cool off with our renowned smoothies, slushies, malts, and iced coffees. Try our fabulous desserts and take an ice cream cake home for that special occasion, or just to treat the family. Dine in or take out at Dairy Queen locations in Homerville, Blackshear, Folkestone, and Fernandina Beach. See you at the DQ. Lutz, Brown, Pigler, and Manley Insurance Agency is locally owned and has been a part of the Homerville, Clinch County community for many years. We make it a priority to know our clients on a personal basis and take pride in customizing insurance coverage for the particular needs of each customer. We offer all lines of insurance, including auto, home, business, life insurance, annuities, and bonds. Lutz, Brown, Pigler, and Manley Insurance Agency, East Dame Avenue, Homerville. Go Panthers!
Want to learn more about rural America? Watch CreekBox TV.
Welcome back, everyone, to CreekBox TV. I'm Alan Handley, and I have two lovely young ladies from Clinch Memorial Hospital here, Miss Angela Ammons and Miss Lily James. Miss Angela, we've been talking about the hospital. Man, is there anything else you want to touch on?
Sure. I mentioned last year about the number of hospitals we had to call on a daily basis to try to get patients out, and I don't want the community to think that that was a last year event.
That's right.
We still struggle every single day if you present to our hospital to try to find a higher level of care for you because the COVID is just infiltrating and taking up all the beds in all of the other hospitals. There's a bad surge. I mean, one day we called over 20 hospitals and still could not get a patient out. And
we were talking off the air, and I said, is it worse now than it was a year ago? And I guess we're heading that way. And you're talking about because of the children are getting it
because
now.
The children, because there's still so much unknown. It's worse, different.
That's right.
And I feel so bad for my staff. It's like we have not recovered. It's like it's pulling a scab off of a wound.
Yeah, you just
we haven't had time to recover from the last one before the next wave hit. So I'm just asking the community to please do your part.
That's right. That's right. Lily, how about you, darling?
Well, going off of asking the community to do your part, I just want to say from my own opinion, please get the vaccine.
That's right.
It's really, Miss Angela was saying off the air earlier, we need 85% of the population to get vaccinated, so these variants will stop. So what, I touched on this earlier and I wanted to bring it back up. Next week, next Wednesday, from 11 to 1, we will be at St. Paul's Church in Pea Ridge, our community task force. It's a big ambulance that's white and blue and it's got our logo on. If you see us, honk, but we will be giving the Moderna vaccine. It's the 2-dose vaccine. And it'll be, Miss Bertha's Soup Kitchen is there on that day, and a team from Clinch Memorial will be there administering vaccines. It's free, it's simple.
That's free.
It's free.
Everybody know it's free.
It's just gonna be a really simple process, and if you see this and you want to share it, or if you want to come, please do. We, like Miss Angela said, our staff is exhausted, this community is exhausted, everyone is tired of COVID, and there is an answer out there, and it is the vaccine. Yes. And so then also next Wednesday from 4 to 6, we'll be in Fargo for that community to get the vaccine. And it's a 40-minute drive from Homerville to Fargo. And so those people really do not have the same access that we do. And those people are right down the road. So we're really trying to make this access better to them. And in the future, we'll have a satellite
Clinic.
Thank you, Miss Angela.
She's so excited about it.
A satellite clinic.
All the time.
So I just want to say that Clinch Memorial really is trying to recognize these communities that we don't think about often, but they are out there and they do need, they're underserved and they need some support. And I think that Clinch Memorial, I might be biased, but I think Clinch Memorial is really
you got to be now.
I know. I just really think Clinch Memorial is doing a great job, and I'm very happy and excited to work here.
Yeah, and I would like to say one last thing. I'm sorry.
No, you're fine.
You know, I know a lot of people do not agree with some of the decisions I've made or the direction I'm going, but I was tasked with doing a job, and that's to save the hospital and to expand health care to all of Clinch County.
That's right.
And there is never a reason for personal gain for any decision that I make.
Right.
But I really do want Clinch County to prosper, and our hospital as well.
That's right, darling. It's like when I was at Rick, all you can do is the best you can do.
Yes,
and that's
right.
it. But God bless both of y'all and the hospital.
Thank you for having
y'all
us.
have been more out for the last year and a half. And I want to remind everybody, I got vaccinated. Please go get vaccinated.
Yes.
Miss Angela, Lily, God bless you. If y'all want to come back, we'll have you back probably in a couple of months and talk some more Clinch Memorial Hospital.
Thank you.
Thank you very much.
We appreciate y'all tuning in. We'll see you next time.
Okay.
You're watching CreekBox TV.